Hello everyone and welcome to my health and wellness information channel. I'm Dr. Gauri Bhide. I'm a medical oncologist, which means that I'm the kind of doctor who takes care of cancer patients. Since my patients come to my office with a large list of vitamins and supplements that they routinely take, I decided to do an informational series on vitamins and other supplements. Here I give an overall review of the information that I have researched. Please do subscribe to my channel for my previous videos. A vitamin is, number one, a compound that is vital for some biochemical process necessary for life, and number two, it needs to be ingested. We do not manufacture it. Most of the vitamins are freely available in our diets, and unless you have a stringent dietary restriction or malabsorption, you will likely not suffer from vitamin deficiency. The real at-risk populations are the ones whose nutrition resources are limited due to poverty or famine, or who are in a refugee situation. Today, I'm going to talk about vitamin E. You are likely not taking it as an extra supplement, but it is part of a multivitamin tablet. And vitamin E containing skincare products have become very popular over the last few decades. For the record, I am not taking a position on these products. First, let's talk about what vitamin E does and doesn't do. As humans, we commonly consume a form of vitamin E called alpha tocopherol. It is called a vitamin because it fulfills the two requirements. It is necessary for a vital biochemical reaction, and number two, we need to consume it. It is available in a wide variety of foods, even vegan diets. It is absorbed through the gut, but because it is a fat-soluble vitamin, it does require digestive enzymes like gastric enzymes and pancreatic enzymes and bile salts. So the people who are at risk for developing deficiency are the ones who have some sort of malabsorption. As adults, we need only about 15 milligrams of vitamin E daily, and people who do not have any extra special need for it shouldn't take it. So how does vitamin E act? It is a free radical scavenger. What is a free radical? When molecules are split into atoms in biochemical reactions in our bodies, sometimes the atoms have an unbalanced number of electrons, which is an unnatural state for them. They steal electrons from the normal components of our body, like proteins and DNA, and damage our tissues in this process called oxidative stress. Vitamin E scavenges or cleans up these free radicals by donating electrons and protecting our body's normal tissue. What can vitamin E help with? Most vitamin E uses have been in dermatology. Oral supplementation improves skin involvement with scleroderma or atopic dermatitis or pressure sores. Stretch marks are a common consequence of pregnancy. In their advanced condition, they can become quite prominent and even permanent. And sometimes, even if they fade, they do not disappear. Their appearance does run in families, and vitamin E containing creams may help. Over-the-counter creams are used to decrease dark under-eye circles, and anti-aging creams often contain 0.5 to 1% of vitamin E. There's not a lot of clinical evidence for the efficacy, but you can determine if it works for you. Where else does vitamin E help? It can help delay the progression of age-related macular degeneration in combination with antioxidants and zinc, and the progression of Alzheimer's dementia can be slowed, but unfortunately, dementia cannot be prevented. In the cancer field, in combination with a drug called pentoxifylline, it can decrease radiation-related fibrosis in breast cancer radiation. Where did vitamin E not fulfill its possible promise? Over the last couple of decades, there's been a lot of work on the role of oxidative stress causing cardiovascular disease and cancer. Clinical studies, unfortunately, have not shown benefit in decreasing these diseases with the use of vitamin E supplements. In fact, in some studies, vitamin E supplements increase the risk of prostate cancer. With regard to heart disease prevention or treatment, again, it looked promising because mechanistically it should decrease atherosclerosis. Vitamin E deficiency was associated with the incidence of atherosclerosis, but again, large clinical trials have not shown any benefit in decreasing heart disease. The American Heart Association recommends obtaining our antioxidants, including vitamin E, through our diet, which means eating a well-balanced diet to include whole grains, fruits, vegetables, and nuts, and not through supplements because the risks and benefits of taking supplements have not been established. An additional note of caution: since vitamin E is fat soluble, it can accumulate in our body and cause toxicity. It can cause bleeding by interfering with platelet function and with vitamin K metabolism. That is why you are asked to stop taking any vitamin E containing supplements before any surgery. And sometimes vitamin E containing creams may cause a rash. Like other fat soluble vitamins A, D, and K, too much of a good thing is a bad thing. I hope you found this information useful. Be in good health and do subscribe to my channel for more health and wellness information coming your way. Take care.